Hip replacements are one of the most successful surgeries in all of medicine, and we've come a long way, and it continues to improve. And in the early days, some of the biggest gains were in the materials we used, and even those used to wear out. Nowadays, with the materials that we have, we feel that there's an excellent chance if somebody recovers well from the initial surgery, that hip replacement could last them the rest of their life. And where a lot of our focus has been recently over the previous few years is focusing on more rapid recovery, better anesthesia protocols, better medicine protocols, and one of the most exciting things in my practice is anterior hip replacements. And anterior hip replacement is, a lot of the surgery is the same, but one of the biggest differences is how we get to that hip joint. And more traditional approaches go through posterior. In other words, they go from the back, and they have to go through some muscles and some structures and tissues that even though they're repaired after surgery, they're just never the same as they were before. And with anterior approach, going through the front, these muscles can be moved aside and not cut, resulting in a more rapid recovery, in addition to lower risk of dislocation has been shown in the literature, and more comfortable recovery. In the posterior approach, one of the biggest muscles we have in all of our body is the gluteus maximus, and there's no way to go from the back without splitting that muscle. So as you can see here, the gluteus maximus covers the entire posterior part of the hip, and we cut through that to get access to the hip joint. And then once you get through the gluteus maximus, these muscles here are the external rotators. We have to cut those muscles to get to the hip joint and do the operation. Now, as we see from the front of the hip, going for the anterior approach, the quadriceps muscles, this one here, the rectus, this one here, the sartorius, we simply move those aside, and then our access to the hip joint is through those muscle planes as opposed to cutting them. So from the patient's perspective, this minimally invasive, muscle-sparing approach provides for a more comfortable, more rapid recovery with a lower risk of dislocation. In fact, we have been doing these outpatient where the patient after surgery, hip replacement, can go home as soon as 3 or 4 hours after the operation.